Good morning, everyone. Today I'm going to talk about the lamination of spino-thalamic tracts. And to start, let me just use the pen to mark these areas, and then you will have a better view of this structure. So while I do this, I will talk about S. What do you think that means S? Okay, what do you think that means L, T, and C? Well, this S stands for sacral. S equals sacral fibers. It is, welcome. Sacral fibers. L stands for lumbar fibers. Lumbar fibers. Then we have T, thoracic fibers. And then C, cervical fibers. Okay, this is the first part. S, sacral fibers, but we also have S here. Okay, we also have S here. T, thoracic fibers, and we also have T here. Now, L, lumbar fibers, we have L here. And C, cervical fibers, C right here. Let me just complete this illustration. Okay. And then here we have this sacral canal. Central canal, sorry. This, and then this. Okay, let me just use this one. Right here. So the spino-thalamic tracts, guys. Spino-thalamic tracts include which you, as you can see here, includes the lateral and anterior pathways. They are organized into layers within the spinal cord. Why? Because this arrangement actually helps to understand how sensory information from different parts of the body will be processed and transmitted to the brain. So let me just paint this part here. There's a few things that are also interesting to mention is that the fibers in these tracts are layered such that the sacral fibers originating from the lower part of the body, which includes the legs and the pelvis, are located most superficially. Okay, they are most superficial, close to the surface. And the fibers, like the cervical one, originating from the neck and the upper limbs, are positioned deeper, way deeper, okay? Away from the surface. And why this organization will basically ensure that the sensory signals from different regions of the body are segregated, and they can be processed independently as they ascend towards the brain. Now, about the cervical fibers, these fibers, as I mentioned, they originate from the neck and the upper limbs, and they are located deepest. The thoracic one arise from the thoracic region, chest and mid-back, and they occupy intermediate positions within the laminae. The lumbar fibers will originate from the lumbar region, and they will also be they are also found in intermediate positions, but closer to the surface compared to the cervical fibers. And then we have the sacral fibers, which is this one, and the pelvis and lower limbs. They are the most superficial within the laminae. Okay. Hi, Jo. Why is so important to understand this delamination of the spino-thalamic tracts? It will be important especially for diagnosis and to treat neurological conditions affecting pain and temperature sensation. So, for example, spinal cord injuries usually will damage specific levels of the spinal cord, and these damages injuries can disrupt the transmission of sensory information. For example, an injury at the higher level, cervical or thoracic, usually affect the deeper fibers, impacting sensation from the upper body. Now, at the lower level, lumbar and sacral will affect the more superficial fibers, especially impacting the sensation from the lower body. Okay. For example, if someone suffers from herniated discs or spinal stenosis, these injuries will compress specific nerve roots, leading to a radicular pain. Okay, and once you understand the lamination, it will be helpful, especially to localize the affected region based on the distribution of the symptoms. There are a few neurological examinations that the physician or the physiotherapist can probably do, but during physical examinations, it's important assessing pain and temperature sensation because this helps to identify the level of the spinal cord, the level of the spinal cord injury. And patients usually report loss of pain sensation in the lower limbs, but they do not mention anything in the upper limbs, which might suggest damage to the sacral fibers, which are much more superficial. In some cases, of course, it's important to address that surgeons must be aware of the precise location of the different fibers, especially the type of the fibers that they will perform the procedures. Okay, why? Because they need to avoid damaging specific sensory pathways, and this is the main reason. Welcome everyone. So yeah, this is what I have for you today, guys. Let me just finish this part. And what I'm gonna do, I'm gonna finish this live, and then I will come back with another live where I will